The idea of experiencing a heart attack while alone is deeply unsettling, yet it's a reality that strikes more often than most people realize. Many assume they'll have time to react, that the symptoms will be unmistakable, or that someone will be nearby to help. However, the truth is far more sobering. The first few minutes of a heart attack are critical, and your immediate actions or failure to act can mean the difference between life and death. The encouraging news is that even if you're alone, you can significantly boost your chances of survival by acting swiftly and following a clear, deliberate plan. In this comprehensive guide, we'll walk you through 7 crucial, life-saving steps to take if you suspect a heart attack while alone. These steps are straightforward, require no medical training or specialized equipment, and are designed to help you stay calm, act decisively, and maximize your survival odds. We'll cover how to recognize subtle early warning signs, what to do immediately, how to reduce strain on your heart, and small but critical actions that can buy you precious time until help arrives. Stay with us until the end, as the final steps are often overlooked, but could be pivotal in saving your life. Let's dive into this vital guide to empower you to take control in a crisis. Step 1. Recognizing the subtle, early warning signs of a heart attack. The first and most critical step in surviving a heart attack alone is recognizing its symptoms as early as possible. Many people envision a heart attack as a sudden, dramatic event with crushing chest pain like the scenes portrayed in Hollywood movies. In reality, heart attacks often begin with subtle, easily dismissed symptoms that can escalate rapidly if ignored. Acting on these early warning signs is your best defense against severe heart damage or a fatal outcome. A heart attack typically manifests as a deep, uncomfortable pressure or squeezing sensation in the center or left side of your chest. This may feel like a heavy weight pressing down a tight band, constricting your chest, or a persistent ache that doesn't quite feel like typical pain. The sensation may come and go in waves, leading you to think it's not serious, but if it lasts more than a few minutes or keeps returning, it's a major warning sign. Beyond chest discomfort, you might experience shortness of breath, even without exertion. You may feel like you can't get enough air, even while sitting still. Pain or discomfort can radiate to other areas, such as your arms, often the left, but sometimes both shoulders, neck, jaw, upper back, or even your stomach, where it might mimic indigestion. Additional symptoms include sudden lightheadedness, cold sweats, nausea, especially common in women, dizziness, or an overwhelming sense of fatigue that feels disproportionate to your activity level. For some, particularly women, older adults, or those with atypical presentations, symptoms may be even subtler, such as mild upper back pressure, vague stomach discomfort, or a general sense of unease without clear chest pain. Consider the case of Margaret, a 70-year-old retiree who was reading quietly in her living room when she noticed a persistent ache under her collarbone, accompanied by clammy hands and difficulty taking a full breath. Initially, she thought it might be stress fatigue or even indigestion from her lunch. However, she recalled a conversation with her doctor about how heart attack symptoms can be subtle, especially in women. By trusting her instincts and acting promptly, she avoided a potentially fatal delay. Your body often provides subtle clues before a heart attack escalates, and these early warnings are your window to act before the situation becomes life-threatening. Waiting for dramatic movie-like symptoms, such as collapsing in agony, could mean waiting too long. To prepare, familiarize yourself with these symptoms and take them seriously, even if they seem minor or vague. Risk factors like high blood pressure, high cholesterol, diabetes, smoking, or a family history of heart disease can increase your likelihood of a heart attack, so be extra vigilant if these apply to you. If you experience a combination of chest pressure, shortness of breath, radiating discomfort, or unusual fatigue, stop whatever you're doing immediately. Don't brush it off as indigestion, stress, or a pulled muscle, and avoid the temptation to tough it out. Recognizing these signs as potential heart attack symptoms is your first and most vital line of defense. Trust your instincts, your life may depend on it. Step 2. Calling 911, immediately to get help fast. Once you suspect a heart attack, the next critical step is to call 911 without hesitation. Do not wait to see if the symptoms improve. Attempt to drive yourself to the hospital or worry about seeming overly cautious. Calling emergency services is the fastest and most effective way to access life-saving care, and every second counts during a heart attack. Delaying help increases the risk of permanent heart damage, cardiac arrest, or death. When you call 911, trained dispatchers begin coordinating a response, and paramedics are dispatched with specialized equipment such as defibrillators, oxygen, and medications to stabilize you. They can also monitor your condition en route to the hospital, which is critical if your symptoms worsen. Driving yourself is one of the most dangerous choices you can make during a heart attack. You could lose consciousness, cause a car accident, or delay access to critical interventions. By calling 911, you ensure that professional help comes to you as quickly as possible, equipped to handle a life-threatening emergency. Take the example of Thomas, a 75-year-old widower who was gardening alone when he felt an unusual ache in his jaw and chest, followed by a wave of nausea. Initially, he considered calling a neighbor or his daughter, but he remembered advice from a community health seminar. If you think it's a heart attack, call 911 first, then contact family. He dialed 911 immediately, and paramedics arrived just as his symptoms intensified into severe chest pain. Their rapid intervention, including administering oxygen and medications, saved his life. This underscores the importance of acting without delay. You don't need to be 100% certain you're having a heart attack to call 911. Emergency dispatchers are trained to handle uncertainty and would rather respond to a false alarm than miss a chance to save a life. If you live alone, keep your phone easily accessible on your person, bedside table, or kitchen counter. Many smartphones have an emergency call feature that works even when the phone is locked. Learn how to use it in advance. If speaking is difficult due to shortness of breath or pain, stay calm and use this feature to connect with help. Some regions allow texting 911 if you can't speak Czech, if this is available in your area. The sooner you call, the sooner help arrives, giving you the best chance of survival. Step 3. Chewing an aspirin to prevent clot growth. After calling 911, the next vital action is to chew a standard 325 milligram aspirin, provided you're not allergic to aspirin and don't take blood thinners like warfarin or apixaban that contraindicate its use. If you're unsure about contraindications, consult your doctor ahead of time to confirm whether aspirin is safe for you. Chewing rather than swallowing allows the aspirin to enter your bloodstream faster, which can significantly improve your survival odds. Aspirin works by thinning the blood and inhibiting platelet activity, helping to slow or prevent the growth of a blood clot that may be blocking a coronary artery, the primary cause of most heart attacks. Research, including studies from the American Heart Association, shows that chewing aspirin during a heart attack can restore some blood flow to the heart, buying you critical time until paramedics arrive. For the fastest effect, use an uncoated standard 325 milligram aspirin, as coated or enteric-coated versions take longer to absorb. If you only have low-dose 81 milliliter aspirin, often called baby aspirin, it can still help, though it's less effective than a full dose. Avoid taking aspirin on an empty stomach if possible to minimize stomach irritation, but in a heart attack, the risk of clotting far outweighs this concern. Consider the case of John, a 68-year-old man who felt a heavy squeezing sensation in his chest one evening while watching TV. He recalled reading about aspirin's benefits in a health magazine, found a bottle in his bathroom cabinet, and chewed a tablet while sitting calmly and waiting for paramedics. His cardiologist later confirmed that this action likely reduced the extent of heart muscle damage, aiding his recovery. If you live alone, store aspirin in multiple accessible locations, such as your nightstand kitchen counter, bathroom cabinet, or even a small container in your purse or wallet. Check regularly to ensure the aspirin hasn't expired, as expired medication may be less effective. Inform family members or close friends where you keep your aspirin in case they need to assist you in an emergency. If you have a history of stomach ulcers or bleeding disorders, consult your doctor in advance about whether aspirin is safe for you. This simple science-backed step is a standard protocol in emergency medicine and can mean the difference between a full recovery and irreversible heart damage. Step 4. Resting to minimize strain on your heart. Once you've called 911 and taken aspirin, your next priority is to minimize stress on your heart by stopping all physical activity immediately. Sit or lie down in a safe, comfortable position and avoid any unnecessary movement. Pacing, gathering belongings, tidying up, or trying to push through the discomfort increases your heart's oxygen demand, which is already compromised during a heart attack. Your heart is struggling to pump blood effectively, and any additional strain could worsen the damage or trigger a dangerous arrhythmia. The ideal position is sitting upright with your back-supported feet flat on the ground and arms resting loosely at your sides. This posture reduces your heart's workload while keeping you stable and comfortable. If you feel dizzy, lightheaded, or faint, lie down on your side with your head slightly elevated, using a pillow or cushion to avoid choking or discomfort if nausea worsens. Resist the urge to keep moving, even if you feel restless or embarrassed about doing nothing after calling for help. In this moment, staying still is one of the most important actions you can take. It conserves your heart's energy and oxygen supply, potentially preventing further damage or cardiac arrest. Take the example of Evelyn, an 80-year-old woman who felt chest tightness and shortness of breath while preparing dinner in her kitchen. Her instinct was to finish cooking and tidy up as she didn't want to leave a mess. However, she recalled her cardiologist's advice: if you think it's your heart, stop everything and rest. Everything else can wait. She sat in her recliner, propped up with cushions, and stayed still, which likely prevented her symptoms from escalating into a full-blown cardiac arrest. If you're in a chair without armrests or back support, avoid slumping. Keep your spine straight to maintain open breathing and reduce physical strain. If you're outdoors, find a safe spot to sit, such as a bench or step, and avoid standing or walking unnecessarily. By resting and breathing slowly, you give your heart the best chance to stabilize until paramedics arrive. To prepare, identify comfortable, accessible spots in your home where you can rest quickly in an emergency, such as a sturdy chair or sofa. If you have mobility issues, keep a walker or cane nearby to help you settle safely. Practicing this step mentally, visualizing where you'll rest and how you'll stay calm, can make it easier to act decisively in a crisis. Step 5. Unlocking your door to ensure quick access for paramedics. If you have the strength after calling 911 and settling into a resting position, unlock your front door to allow paramedics immediate access. This small but critical action can save precious seconds, as a locked door may force responders to break in, delaying treatment. In a heart attack, every second counts. Faster access to care can mean the difference between recovery and severe complications, such as permanent heart damage or death. If you live in an apartment, condo, or gated community, consider additional logistics in advance. Is your address clearly visible from the street? Do you have a spare key stored with a trusted neighbor or in a secure medical lockbox? A smart lock with a code can also simplify access for responders. Share the code with 911 dispatchers if possible. For example, Michael, a 73-year-old man living alone in a condo, felt heart attack symptoms one morning. After calling 911 and chewing an aspirin, he managed to unlock his front door while staying seated near the entryway. Paramedics later told him that this saved them nearly a minute of entry time, which was critical as his condition deteriorated rapidly into ventricular fibrillation. Their quick access allowed them to use a defibrillator in time to save his life. If walking to the door feels risky or causes increased pain or dizziness, prioritize staying still and breathing calmly. Your safety comes first. However, if you're stable and near the door unlocking, it can significantly speed up the response. To prepare, consider keeping a spare key in a secure but accessible location, such as a lockbox with a code, and inform 911 dispatchers of its location if needed. If you live in a multi-story home, try to position yourself on the ground floor near the main entrance to make it easier for paramedics to reach you. These small preparations can make a big difference in an emergency. Step 6. Using your phone's emergency features. Effectively, your smartphone is a powerful lifeline during a heart attack, and using its features wisely can enhance your chances of survival. When speaking with 911, switch to speakerphone mode to keep your hands free and reduce physical strain. This allows you to focus on breathing slowly and staying calm while ensuring the dispatcher can hear you clearly, even if your condition worsens. Dispatchers are trained to pick up on subtle cues such as changes in your breathing voice or background noises, which can help them assess your situation and relay critical information to paramedics. Additionally, set up your phone's emergency medical ID feature, available on both iPhones and Android devices. This feature allows you to store vital information such as your age, blood type, medical conditions, e.g. diabetes or heart disease, allergies, e.g. to aspirin or penicillin, current medications, and emergency contact numbers. This data is accessible from your phone's lock screen, meaning paramedics can access it even if you're unconscious or unable to communicate. For example, Clara, a 77-year-old woman, felt chest pain and dizziness while alone at home. She called 911 but fainted before paramedics arrived. Fortunately, her medical ID alerted responders to her diabetes and penicillin allergy, preventing potentially harmful treatments and guiding their care. Setting up your medical ID takes just a few minutes. Do it now by navigating to the health or emergency settings on your phone. Some smartphones also allow you to share your location with 911 dispatchers, automatically ensuring help finds you quickly, even if you can't provide your address. If you're in an area with text to 911 capabilities, you can send a message if speaking is too difficult. Check with your local emergency services to confirm availability. To prepare, practice accessing your phone's emergency features such as the SOS button or medical ID so you can use them instinctively in a crisis. Keep your phone charged and within reach, especially at night or when you're alone. These small steps can ensure your phone becomes a critical tool for survival. Step 7. Controlling your breathing to stay calm and stable. Panic is a natural response during a heart attack, but it can worsen your condition by increasing your heart rate and oxygen demand, potentially triggering dangerous arrhythmias. Controlled breathing can help calm your nervous system, lower your heart rate, and reduce strain on your heart. One effective technique is to inhale slowly through your nose for 4 seconds, hold your breath for a brief moment, about 2 seconds, and exhale gently through your mouth for 6 seconds. Repeat this cycle, focusing on the rhythm to anchor your body and mind. This won't reverse the heart attack, but it can help stabilize your heart rhythm and maintain oxygen flow, buying you critical time until help arrives. Consider the story of Robert, an 82-year-old man who felt intense chest pain and overwhelming fear one night. He remembered a breathing exercise he'd learned during physical therapy for a previous heart condition. By focusing on slow, steady breaths, inhaling for 4, holding briefly, and exhaling for 6, he kept his heart rate from spiking dangerously until paramedics arrived. His calm response likely prevented his symptoms from escalating into cardiac arrest. You can practice this technique during calm moments, such as while relaxing, meditating, or watching TV, so it becomes second nature. Other calming techniques like visualizing a peaceful scene or repeating a calming phrase, e.g., "I am safe, help is coming," can also help manage panic. To prepare, practice controlled breathing regularly, especially if you're at higher risk for heart issues due to factors like age, high blood pressure, or a history of heart disease. If you have a smartwatch or fitness tracker with a heart rate monitor, use it to monitor your pulse during practice sessions to ensure you're staying calm. In a crisis, this small act of control can make a significant difference in keeping your heart stable until help arrives. Final thoughts: preparation and action are your greatest allies. Surviving a heart attack alone isn't just about luck, it's about preparation, awareness, and decisive action. These 7 steps: recognizing symptoms, early calling 911, immediately chewing an aspirin, resting to reduce heart strain, unlocking your door, using your phone's emergency features, and controlling your breathing form, a powerful evidence-based strategy to maximize your survival odds. Each step is designed to buy you time, minimize damage to your heart, and empower you to take control even when you're alone. Reflect on these steps and take proactive measures. Now, do you have aspirin stored in accessible locations? Is your phone's medical ID set up with your medical details? Is your front door easy for paramedics to access? Have you practiced controlled breathing to stay calm under pressure? These preparations take minimal effort, but can make a life or death difference. Share this knowledge with loved ones, especially those who live alone or have risk factors for heart disease. Discussing these steps with family or friends can also ensure they know how to assist you in an emergency. For example, tell them where you keep your aspirin or how to access your home if you're unable to unlock the door. Consider enrolling in a basic first aid or CPR course to deepen your understanding of emergency response and encourage others to do the same. If you have a history of heart issues, talk to your doctor about creating a personalized emergency plan, including whether aspirin is safe for you and what specific symptoms to watch for. Ultimately, surviving a heart attack alone comes down to acting fast and staying steady. By preparing in advance and following these 7 steps, you give yourself the best possible chance to survive a heart attack and recover fully. Don't wait for a crisis to take action. Start today, stay vigilant, and empower yourself to face this potential emergency with confidence and clarity.